Hi, my name is Jowanna Malone, and I'm a PhD candidate at Johns Hopkins Bloomberg School of Public Health. And I'm going to be presenting data from the NA cohort, so North American data. And my analysis is entitled Race-Based Associations Between Racialized Economic Segregation and Viral Suppression Among Men Who Have Sex with Men in the US. So a little bit of background. So as many of you probably well know, that in the US there's a high burden of HIV among men who have sex with men, and particularly among Black men who have sex with men. And there's been a recent initiative ending the HIV epidemic, EHE initiative in America to end the HIV/AIDS epidemic by 2030. And one key pillar of that is by reducing HIV incidence by 90%. So in order to do that, there's a sense of urgency in addressing factors that might influence viral suppression, especially among Black MSM, where this is a known population that has an extra burden of this epidemic. And so there's been a growing focus on neighborhood factors such as racial and economic segregation, as opposed to individual level factors that we, again, have studied before about condom usage, sex partner number, and things like that, because these things don't seem to still explain away those differences between Black and white MSM or other racial groups. And so there's a lack of literature documenting certain things such as segregation and how it might relate to things like viral suppression. We measured segregation, both racial and economic, using something called the Index of Concentration at the Extremes. So briefly, this is a score that can be assigned to any areal unit. In this case, we use zip code level. And a score of -1 means there's a high concentration of disadvantage, so that could be either low-income residents or Black residents. And then a score of +1 means a high concentration of advantage, so either a high concentration of white residents or high-income residents, or both. Our primary outcome was viral suppression, and our secondary outcomes were retention in care and record of treatment at the time of viral load measurement. This was a cross-sectional study that included data from January 1st, 2016 up until December 31st, 2018. So we included over 7,000 participants who reported male-to-male sexual contact, who were above the age of 18, had available 5-digit zip code information, and had at least one viral load measurement over the time period. And this spanned across 383 zip codes across 7 states that are also the same states that are focused on in the EHE initiative. We conducted group-level logistic regression in which we compared zip code level I-scores and the odds of being virally suppressed given the quintile of I-score that someone was living in. And we adjusted for education, prevalence of people on federal aid, unemployment prevalence, and as well as the prevalence of Black residents for each model. This slide is showing the median level of each covariate, so the percentage of Black residents, the percentage of residents who had a high school diploma or higher, and so on and so forth. And this gives an overview of the individual level data that was used. This wasn't the focus of the models that were used, but just to give you an idea of what the demographics of the participants looked like. You can feel free to look at this slide. So here we see that when it comes to racial and racialized economic segregation, that there is an association between higher levels of those variables and viral suppression, and that there are higher levels of viral suppression. However, when it comes to economic segregation, those associations went away after we adjusted. However, this wasn't the same when we stratified by race. So as you can see highlighted here is that among Black participants that racial, economic, and racialized economic segregation was associated with viral suppression. However, this was not the case among white participants unless we only looked at the higher levels of racialized economic segregation. And this is just repeating, summarizing what we found after we adjusted. So all in all, these results suggest that disparities in viral suppression due to segregation particularly impact Black MSM that live in areas with high concentrations of Black residents and high concentrations of particularly low income Black residents. And so these types of areas should be a target and a priority for any type of interventions or efforts that try to address viral suppression levels among Black MSM in the US. Thank you very much.